Welcome to The Explainer. Today, we're diving into a medical emergency, one that can take one of your most vital organs from perfectly healthy to complete failure, not over years, but in just a few weeks. Let's jump right in. So just think about this for a second. What happens when one of your body's hardest working organs just starts to give up? And I'm not talking about a slow, gradual decline. I mean a catastrophic failure that happens in just days or weeks. Well, that's the scary reality of what we're talking about today, acute liver disease. Okay, so what is this thing officially? Well, acute liver disease is all about the sudden onset of really significant liver dysfunction. The key phrase to lock onto here is days to weeks. That incredible speed is what makes it so dangerous. It can spiral and fast into what's known as acute liver failure, or ALF for short. All right, Section 1, the many potential causes. So this begs a huge question, right? What on earth could cause such a rapid collapse? It turns out the list of triggers is pretty varied, and for doctors, finding the culprit is like a race against time. And when I say the list is varied, I mean it. You've got infections like hepatitis A, B, or E. Then there are drugs and toxins. Sometimes the body's own immune system goes haywire and attacks the liver. That's autoimmune hepatitis. It can even be caused by a sudden loss of blood flow, something called shock liver, or certain rare metabolic diseases. But you know, out of all those possibilities, there's one that's shockingly common, especially in developed countries, and it's an overdose of paracetamol. You probably know it as acetaminophen. Yeah, that everyday pain pillar that's in pretty much everyone's home. This is a really important one to lock in. And it's not just paracetamol. The list of other specific culprits is, well, it's pretty long. We're talking certain antibiotics, drugs used to treat tuberculosis, and even some herbal or traditional medicines. And then you have the really scary stuff from nature, like the poison in the infamous death cap mushroom. Definitely not something you want to mess with. Okay, Section 2, recognizing the warning signs. Given how fast this all happens, how would you even know it's starting? Your body does send out alarm bells, and we need to talk about what those are. You see, it often starts with symptoms that are super vague, the kind of stuff you might just brush off. You know, feeling tired, a bit of nausea, maybe some pain in your belly. But as the liver gets worse, the signs become impossible to ignore. We're talking about really severe things like jaundice, that's when your skin and eyes turn yellow, or even serious confusion. The liver helps your blood clot, so you might start bruising really easily too. And that jaundice, that is the absolute classic telltale sign that something is going terribly wrong with the liver. It happens because the liver can't clear out a substance called bilirubin, so it builds up and literally stains your skin and eyes yellow. If you see that, it's a huge red flag, a get to the hospital now kind of red flag. Right, Section 3, how doctors diagnose it. So once someone shows up with these signs, it's a race against the clock for doctors to figure out what's going on. Let's walk through how they do it. So the process is pretty logical. They start with the basics. Step 1 is running a bunch of lab tests, mostly blood work, to see what's happening chemically. Step 2, they'll usually do some imaging, like an ultrasound or a CT scan, to actually get a look at the liver. And if they're still stumped, Step 3 might be a liver biopsy, where they take a tiny piece of the liver to examine. And in that initial blood work, this is one of the biggest things they're looking for. See these liver enzymes, ALT and AST? Normally, your levels are down here, nice and low. But with acute liver failure, whoosh, the levels just go through the roof. It's a massive, undeniable signal that the liver is in deep trouble. But it's not just the enzymes. The blood tests give them a ton of other clues. They're looking for high bilirubin, which confirms the jaundice we talked about. They check something called the INR, which tells them how well your blood is clotting or isn't. High ammonia levels can explain any confusion. And of course, they're hunting for the cause, so they'll test for things like hepatitis viruses or those autoimmune antibodies. Okay, Section 4, managing the critical condition. Once they have a diagnosis, everything shifts. The focus becomes all about management. And let's be clear, this is not a rest-at-home situation. It's a full-blown medical emergency. Yeah, there's no messing around here. Management is critical, and it absolutely means a trip to the hospital. In fact, more often than not, it means a stay in the intensive care unit, the ICU, where they can be monitored around the clock. So what happens in the ICU? A huge part of it is what's called supportive care. Basically, the medical team takes over managing the body's essential functions to give the liver a chance to recover. We're talking about closely watching vital signs, managing fluids and electrolytes perfectly, and providing very specialized nutrition. If the patient is confused, they might even get a special low-protein diet. And while all that support is happening, if they know the specific cause, they hit it with a targeted treatment. It's like having the key to the lock. For a paracetamol overdose, there's a specific antidote called N-acetylcysteine, or NAC. If it's something like hepatitis B, they bring in the heavy-hitting antiviral drugs. Whew, we've moved through that really fast, kind of like the disease itself. So let's slow down for a second and just recap the absolute key takeaways you should remember. Okay, 4 main points. 1, this thing is fast. It develops in days to weeks, not years. 2, there are a ton of potential causes, but remember, paracetamol overdose is a really common one in the West. 3, the symptoms start vague but get severe, and jaundice is that huge warning sign. And 4, treatment is an emergency. It happens in the hospital and is all about supporting the body while trying to fix the underlying cause. At the end of the day, knowing about this stuff is crucial. Just being aware of the causes and recognizing those signs is the first, most important step. Because with a condition this fast, a swift response is everything. So I'll leave you with this to think about. What was the most surprising thing for you in all of this? For me, it's just the sheer speed of it all. Thanks for tuning in.